So and we know that 80% of people's health doesn't happen in the physician's office. It happens in your life. It happens in your community. And so being able to take all of that information in addition to what's happening, with your medical protocol, your social behavioral, bring it together and then, have recommendations for how do we intervene sooner, how do we help you, how do we help your caregivers, I think is really exciting. And we've built, we're doing like 4,000 of these a day with our clinicians, sending them what we call these whole health interventions for them to basically meet with the patient and help them identify that so they don't have to do it up front and think about it. I think those are real opportunities.
Now, I've kind of gone overboard focusing on generative AI. There are other technologies that are really important, and when we're talking especially health data, there's the whole issue of interoperability, and this has been a huge push by your whole organization. We've tried in our cloud, actually not just in our cloud, but working with the other major cloud vendors to try to be as supportive as possible. Are we making progress on interoperability?
Slow. I think we're making some. I think we have a huge opportunity to accelerate it. I think that is sort of embedding it across the industry. And I'm actually quite encouraged. We participate in a number of industry forums. I think with EMR vendors, there's nothing proprietary about how we should be sharing data back and forth, particularly clinical records. We're all doing it. We all have to do it for regulatory as well as clinical purposes. The ability to do that across everything, I think, is a big opportunity. So we're meeting in groups, we're talking about, I think we've made some progress, but I think we still have a big opportunity to continue to do that.
Okay. So I'm going to change the subject a little bit now and shift to this relationship. It's actually kind of underlied almost everything you said here today, the relationship between payer and provider. And that, of course, has been evolving a lot. It's actually gotten more diverse, more, in a way, harder to understand. So can you demystify this, or at least what is the Elevance view of the best working relationship between provider and payer?
Yeah, I don't know if I can demystify, that's a tall task, but I'll try in terms of our perspective. I mean, we think care providers, I'll go back to the ecosystem. We all have very unique roles in this health ecosystem. And our goal in the ecosystem is to work as effectively as possible around accessibility and affordability and simplicity. And oftentimes, we get into things around affordability. For example, I think our best opportunity is we're very focused on value for payment and moving the system to value-based care, providing data at the right time and intervention in the system. Our goal is to have, the majority of all of our arrangements of value-based care and to bring, along individuals. It sounds really simple, but it's really hard. And it requires a different way of practicing, and it requires us to share data ubiquitously, real time. It requires us to have very specific roles in the system. So I think there's a big opportunity. I think the huge opportunity for us in the short run is what we've talked about, which is to take some of the burden off of both parties right now. We get into a lot of discussion around pre-authorization. Well, by sharing this clinical data back and forth, we can take away a lot of that burden by being very upfront about what we need, getting the data correctly, and then letting the care providers know exactly where they are, so they're not spending all that time. And I think that begins to build some trust. It also frees them up to invest in other things and be much more focused on the clinical care side. So we view it as a critical trading partner, a critical part of the ecosystem. There are times when it's not always as, we're in different parts of negotiations, but I think ultimately we generally get to the right place, and I'm really encouraged because I think with technology and data, and our ability to take the noise out of the system, we can actually drive much better outcomes and better care on both sides. And I think ultimately that's our goal. It's certainly our goal for patients. Consumers want that. I think care providers ultimately want to be able to practice much more simply.
Yeah. So we are at the Consumer Electronics Show, and so I think we had a good focus on consumers. If we're back here together 1 year, in 2025, what do you think will be different?
I think we're going to have better outcome use cases for where we've deployed this now. Part of this is we started with experimentation, and now we're moving to scale and in our own enterprise. And we're getting better at understanding what the outcomes are. And I think we're getting smarter at where to deploy this. So I think a year from now, we're going to have very much clearer understanding of the outcomes and where we can accelerate even faster. And lots of people have talked about, are we under or overestimating impact? And I think in the short run, we're probably overestimating, and certainly in the long run, underestimating, but it's coming faster. So the half-life is much quicker. And again, I look at those three categories, I think it will be much easier for consumers to use and understand and be an integral part of the system. I think for us inside of the business part of healthcare, those use cases can be scaled pretty quickly, and we can continue to show value and demonstrate that. I think the insights and outcomes where it's more clinical, at least on our side of the business, will probably be slower to emerge because we need to be more careful about building that trust together and making sure that we have it right. But I think in the first two use cases, we can move at rapid speed, and I think we're going to see the outcomes of that in this next year.
So we're coming close to the end of our time here, and I wanted to ask you, I'll give you a choice. I wanted to go next to some of the community-based thinking that you're doing. But let me give you the choice between the last couple of minutes we have here, between that or any other thing that you'd like to have this audience leave with here today.
Can I do both a little bit? I'll do community first. I do think, I'll go back to how important community is for us to be interconnected. And that's not just the payers and care providers, but also the city government. There's a ton of data in our public health system that we need to connect, and we saw that certainly through COVID. And I'm excited. I think we really have to focus as a system on whole health. So the interconnection of physical, behavior, and social. And we've often, when we talk a lot about medical health, we're talking more about behavioral health, and certainly we see that in the numbers right now. And social, sort of, what we talk about, but it's not integrated. So I think the big opportunity there is for us to connect those pieces, truly connect them and stop the silos that we've historically operated in. And again, that will take trust, and it will take data, and it will take integration of systems. And I think the only thing I'd leave you with, I think it's a really exciting time in our industry. And I'll go back to, we have to be responsible, we have to move. We can't get so excited that we move faster than the market and the participants are ready, and we have to move, I think, at the speed of trust. Because if we lose that, we will not be able to do, I think, the incredible things and the potential that we have to do.
Well, just from my vantage point, looking at what you are doing at Elevance, you are moving fast, but it is impressive, the care with which you're doing it. And we're hearing a lot just on the focus on consumers, on the focus on trust. I think it'll make a real difference. Yeah, well, thank you. We have an incredible team who has been working on this for a long time, and I think long before it became sort of in the lexicon of everyone talking about it. And I think part of that has allowed us to mature and integrate it into our business. And again, now I think it is about the democratization of it, meaning, again, everyone getting, not to be afraid of it, to try it, to play with it, to use it, but also protect the data. And healthcare data is so precious that we have to protect it, especially, and people have to opt into it. I think that's going to be really important. Well, thank you, Gail. It's been a real honor to spend this time with you, and we're counting on you to make this right.